My name is Connor Byers, and this is my head to toe, not so close, please. My head to toe assessment. And this is my sister Emma, as she's going to be my patient. Knock, knock.
Come in.
Hi, my name is Connor. I'm going to be your student nurse today. I'm going to perform hand hygiene. I'm going to give us privacy. I'm going to raise the bed to working height. Can I look at your armband? Can I verify your name and date of birth?
Emma Byers, 08/21/06.
Okay, so at first inspection, patient's dress is appropriate for the exam. Their speech is normal. They're on room air, and their breathing is not labored. So I'm going to do a head to toe assessment on you. I'll start from your head and go down to your feet. Do you mind if I touch you during the exam?
I don't mind.
Okay, so we're going to start with your head. Upon first inspection, the skin is appropriate for ethnicity. I'm going to feel for any lumps or masses on the head. There were no lumps or masses noted. Now I'm going to check your ears and nose. The ears and nose are normal, and there's no redness or any drainage noted. Now I'm going to assess your pupils using Perla. I am going to rate your pupils at about a 5 right now. I'm going to shine this light in your eye. Pupils went from about a 5 to a 4. Now I'm going to have you look at the wall, and then when I say look at the pen, look at the pen. Look at the pen. Okay, pupils are equal, round, and reactive to light and accommodation. Now I'm going to go on your neck. I'm going to check for the JVD vein. JVD vein is flat. Now I'm going to listen to your carotid pulses. Carotid pulses bilaterally are +2, which is in normal range. Okay, now we are going to do your arms. If you'll pull up your sleeves, please. Skin is normal for ethnicity. I'm going to feel, sorry if my hands are cold. Skin is dry and warm to the touch, which is normal. Now I'm going to check your brachial and radial pulses. Okay, brachial and radial pulses are +2. Now I'm going to assess your capillary refill in both fingers. Because she has nails, I'm going to press on the sides. Capillary refill is less than 2 seconds, which is perfect. Now I'm going to check your grip strength and your muscle strength. I'm going to have you grip my fingers. Now I'm going to ask you to push on my hands. Push up. Grip strength and muscle strength are good and normal. I'm going to check the bony providences on your hands and look for any dryness or cracking. Bony providences look good. I'm gonna look at your elbows. Okay, another elbow. Awesome. And there was no skin breakdown noted. Now we're gonna go to your legs. Can I ask you to pull your leggings up a little bit for me? Okay, so now I'm going to assess the skin. The skin looks normal for ethnicity. I'm going to feel. Skin is dry, warm to the touch, appropriate color, pink tones. Now I'm going to assess for any edema, swelling, or redness. There's no edema noted. Now I'm going to ask you to take your socks off. I'm going to check the capillary refill in your toes. I will hide your toes. Okay. Capillary refill is less than 2 seconds bilaterally on both feet. Now I'm going to check your dorsal pedius and your posterior tibialis pulses. Okay, both pulses were +2. Now I'm going to check your muscle strength in your legs. Ask you to push up on my hands. Okay, push down. Dorsal muscle strength in legs bilaterally are good and strong. You can pull your leggings down.
My socks.
I'm going to assess the bony prominences on her ankles. They look good. There's no skin breakdown. Now I'm going to listen to your heart sounds. And you can put your socks on if you would like, yes.
Go ahead.
Okay.
Just like put these away.
I'm going to assess the aortic, the pulmonic, the Erb's point, the tricuspid, and mitral valve. The aortic is in the second intercostal space on the right sternal border. The pulmonic is in the left intercostal, or in the second intercostal space on the left sternal border. Erb's point is on the third intercostal space on the left sternal border. The tricuspid is in the fourth intercostal space on the left sternal border. On the left sternal border, and then mitral is in the midclavicular line on the left sternal border. Aortic, tricuspid, or pulmonic. Now I'm listening to Erb's point. Tricuspid, and the mitral. Okay, I heard S1 sounds best at the apex of the aortic, and S2 sounds best at the base and in the mitral location. Now I'm going to check your apical pulse. For 1 minute. Okay, apical pulse is +2. And there were no murmurs or there were no murmurs in any of the points, and normal rate and rhythm in the aortic, pulmonic, Herbs Point, Tricepsid, and mitral. Okay, now I'm gonna listen to your abdomen or your bowel, or now I'm gonna look at your abdomen and listen to your bowel sounds. If you don't mind turning this way and laying on your back. Do you mind lifting your shirt a little bit for me? So, inspection, the abdomen is flat, and now I'm going to listen to all 4 quadrants in the abdomen for bowel sounds, starting in the right quadrant. All bowel sounds in all 4 quadrants are normal active. Now I'm going to palpate. Let me know if there's any discomfort when I do this. Starting in the right quadrant first. There was no tenderness or any masses or lumps noted in all 4 quadrants of the abdomen. Okay, now I'm going to have you sit back up and we're going to listen to your lung sounds. And you can just breathe normally for me. Okay, there were no intravenous lung sounds noted anteriorly in the front. Now I'm going to have you turn around so I can listen to your lungs on your back. Okay, there were no adventitious lung sounds posteriorly on the back, and I'm going to look at the skin on your back and make sure there is no breakdown. Skin on her back looks good, skin on her abdomen looks good, there was also no breakdown, no discoloration. Now I am going to check any lines, drains, or tubes that she would have, which she does not. Okay, that concludes our head to toe assessment. Oh wait, no it does not. Do you know where you are?
I'm in my room.
In your room? Okay, do you know what the date is?
December 5th.
December 5th. And, do you know what time it is?
10:20.
10:20. And do you know why we are here?
It's for a checkup.
For a checkup in my head to toe assessments. So patient is alert and oriented all ×4 to person, place, time, and situation. Now our assessment is finished. I'm going to lower the bed because I raised the bed when I came in to working height. I'm going to lower the bed, raise both side arm rails, and give you your call light.
Thanks.
If she had grippy socks, I would put grippy socks on her to decrease fall risk. Thank you for your time.
Of course.
If you need anything, just hit the call light and we will be with you. I'm gonna wash my hands on exit.
Hello, my name is Emma. I'm going to be your nurse today. Could you tell me your name and date of birth, please?
Kylie, 6204.
I'm just going to verify that with your wristband. Okay, Kylie, today I'm going to be doing a head-to-toe assessment on you. It just consists of like a series of like different tests, just looking around, kind of feeling areas and listening to certain things. Do you have any questions for me? Do you have any allergies that you're aware of?
No, I don't.
No allergies. Are you in any pain today? Okay. So I begin with starting observing the client's overall demeanor. She is calm, she's cooperative, making eye contact. She is well groomed, well dressed. She is able to hear me and respond back with clear speech. Her skin color overall is even. There's no signs of any deformities. Okay. I'm going to tell you 3 words, and I want you to repeat those words back to me. And at the end of the assessment, I'm going to have you repeat those words once again. Light, tight, and dynamite.
Light, tight, and dynamite.
Okay. And then I'd obtain a set of vital signs. I'm going to ask you a few silly questions, and can you tell me where you are right now?
I'm in the HSH bus.
Do you know what time it is?
It's a little after 11
And the date?
October 6, 2024.
The client is oriented to person, please and time. All right. I'm just going to start by taking a look at your head for any signs of tenderness, etc. To start with, I look at the client's hair distribution. It's even. There are no signs of any lesions, wounds, or redness or infestation. All right, I'm just going to feel around, and I want you to let me know if you have any areas that are kind of tender, okay? Feeling for any bumps, any areas of tenderness. Nothing there? Oh, I need to hear it. No? Okay. And I'm just going to move on to your face. I know the overall skin color is even. There are no signs of any moles, any redness, bruises or lesions or wounds. Alrighty, and I'm just going to feel around your sinuses. Is there any swelling there, any tenderness?
No.
There. I'm going to have you smile for me. Raise your eyebrows and puff out your cheeks. Okay. And then I'm going to have you close your eyes, and I'm going to touch your face with a wisp of cotton. And you're going to tell me if you feel it and where.
Feel it on my left cheek. Feel it on my right cheek. Feel it on my forehead. Feel it on my chin.
Okay. And for your jaw here. Can you clench down for me? Okay. Clench down. Alright, I'm going to move on to your eyes. I'm going to come up here. To start with, I know the distribution of the eyelashes are even. The sclera is white. The iris is clear. Do you have any trouble with like any vision concerns? Kind of like maybe a white film over everywhere you see, or any floaters, anything like that? Okay. Take a look at the client's eyes. We are accommodating to light. Eyes for people. Pupils go round. Alright, I'm going to take a look at this pen. And then take a look at the red fire one. pull around the other to right and then tighten it. Okay, Ellie, I'm gonna have you follow this pin for me, okay? Okay, I move into smooth, and now I'm going to have you actually stand up for me, and we are going to perform a vision test. I have you standing 20 feet from here. Can you read line number 8 for me?
No.
Okay. We'll move up to line number 7.
Still no. So
Okay.
sorry.
Let's try line number 5.
E, D, F, C, C, E.
Okay, line number 4.
P, E, C, F,
Well, what about this one?
L, P, E.
Okay, this one?
P, E, C, F, B.
And then this one?
E, D, P, C, C, P.
Okay. And then I'll have you cover one eye and read line number 5 for me.
P, E, C, F, D.
And the other eye.
F, E, C, P.
Okay. Some vision concerns there. Kylie, do you wear any glasses?
I do.
Okay. You bring them with you?
Yes.
We'll try again with the glasses on.
Oh, okay. Sorry, I'm blind.
Okay. Can you read line number 8?
D, E, F, P, O, T, E, C.
Okay. And then can you cover one eye, please? And read it again.
D, E, F, P, O, T, E, C.
And then other eye.
D, E, F, P, O, T, E, C.
Client has 20/20 with her glasses on. And I'm going to have you hold this about 16 inches from your face. And for this line.
3, 7, 4, 2, 5, 8. So front, backwards, E, W, regular E, X, X, O.
Okay. And can you cover one eye for me? I'll hold it here for you.
3, 7, 4, 2, 5, 8. And that backwards E, inside a W, and then forwards E, X, X, O.
And your other eye.
Say 3, 7, 4, 2, 5, 8. Then backwards E, W, regular E, X, X, O.
Okay. And then I'll have you do that again with your glasses.
3, 7, 4, 2, 5, 8. Backwards E, W, forward E, X, X, O. 3, 7, 4, 2, 5, 8. Backwards E, W, forwards E, X, X, O.
And cover your other eye, please.
3, 7, 4, 2, 5, 8. Backwards E, W, forward E, X, X, O.
Okay. Kind of 20/20 vision with glasses on. Go ahead and have a seat for me again. I'm just now going to be taking a look at your nose. The overall skin color, there's no signs of swelling, it's midline. Take a look again. No signs of any redness, pallor, or discharge. Septum is intact and midline. Alright, Kelly, I'm going to have you plug one nose or one nostril and take a deep breath in and out. And then other side. Okay, did you have any trouble with that? No? And now I'm going to have you close your eyes and then plug one nostril again for me. And I'll have you identify this scent. 1, And then the other way. Okay. Alright, now I'm gonna be taking a look at your ears. Can you hold your hair back forward, please? Ears are long like this, and I'm just gonna take a look. There's no signs of any redness or swelling, no foreign objects or discharge. No signs of any redness or swelling, or discharge or foreign objects. Now I'm just going to feel around the tragus. Is there any tenderness there? No. Any pain? As well on this side. Any tenderness there? No. Okay. And now I'm going to just go behind you, and I'm going to say a word, and I'm going to have you repeat that word out to me. I'm going to whisper it, and I'm going to have you cover one of your ears, please.
Okay.
Monkey. And then other ear.
Brazil.
Okay. Okay, and now I'm just going to be taking a look at your mouth. Do you have any partials or dentures? Nothing like that? Okay. No signs of any missing teeth. Gums are not inflamed or swollen. Mucosa is pink and moist. No signs of any ulcers or lesions or white patches. I'm going to have you say all for me. Uvula is rising. Can you stick out your tongue for me? Protrusion is midline. Okay. Alright, I'm just going to have you swallow for me. Was there any difficulty there? Okay. Now I'm going to be taking a look at your neck for any signs of moles. I know the overall skin color is even throughout. No signs of any ecchymosis or edema. I'm just going to feel your throat here. Trachea is midline. I feel it better as well. I'm going to feel your lymph nodes, and I want you to tell me if there's any like tenderness when I do that, okay? No tenderness there? Okay. Now I'm going to have you turn your head back and forward and side to side. I'm going to have you shrug your shoulders against the resistance of my hands. Okay. And then I'm going to have you turn your face against the resistance of my hands. Okay. I'm going to have you turn your head once more, and I'm going to check for any jugular vein or distension. Oops. And the other side one more time, please. Okay. Now noted. Now I'm just going to listen for any bruise. No bruise noted. I'm also going to feel your carotid arteries. Okay, and now I'm just going to take a look at your arms. I look at the overall skin color, any signs for any lesions or wounds, moles, or edema, ecchymosis. I feel for temperature and moisture. No signs of either of those. And I'm going to take a look at your hands. No signs of any clubbing or fungus. I'm going to press down and assess capillary refill, lasting 3 seconds. I'm going to feel your pulses in your wrist here. +2 bilaterally. Okay, and I'm going to have you stretch your arms out like this. And then to the sides. Can you do 5? And then back to the sides. And I'll have you touch your nose. Both hands. Then your fingers to your thumb. Okay. And then have you go like this. Can you pull against my arms? And then push against me. Okay. And have you push your leg up against my hand too. Other side. Okay. I'm going to be taking a look at the client's thoracic expansion, taking note of the symmetry and the rate and rhythm. Client is not breathing rapidly or too shallow. Respirations are normal, not labored. Okay, and then I take a look at the client's posture. No signs of kyphosis. Okay, I'm going to be taking a look at your back now. Can you move your hair for me, please? Okay, look, assess the skin color for any signs of ecchymosis, wounds, lesions, moles. None of that noted. Skin colors link out. I take note of the spine from the posterior view. There are no signs of any scoliosis. Okay, I'm going to feel down your back here, and if you feel any area of tenderness, please just let me know. Okay. Any tenderness there?
No.
Okay, now I'm going to assess your Achilles here. Is there any tenderness there?
No.
Now I am going to percuss, just kind of bang on your back a little bit. Other side of resonance, and then this side. Okay, Heather, I'm going to be taking a listen to your lungs. Do you have any history of like chronic lung diseases or tobacco use, smoking?
No.
No? Okay. Oh, and every time I put the stethoscope to your skin, I'm gonna have you take a deep breath in and out. And if at any moment you feel like you need a break, please just let me know. Ready? Lung sounds are clear and bilateral. Okay, now I'm just going to be doing the sides here. Okay, so same thing, deep breath. And now I'm going to come over to the front and do it once more. Same thing, deep breaths in and out. lung sounds are clear. Okay, now I'm just going to have you go ahead and lay back once again. And I'm going to be raising your bed a bit. And lay flat now.
This is really comfortable bed.
It is. They are very nice.
Take it more.
Yeah, go ahead. All right, I'm going to take a look at the client's chest, taking note of any signs of ecchymosis, wounds, lesions, moles. The skin color is even throughout. Okay, I'm going to pinch under your collarbone here, just checking for any bounce back. No signs of any tinting. All right, now I am going to be taking a listen to your heart. And at one point I will be listening for a full minute. There's no area of concern though. Pulse rate is 72, no arrhythmias noted. Okay, now I'm going to be taking a look at your stomach here, okay? Can you move your hands for me? Okay, so I take note of the client's overall skin color, any signs of lesions, wounds, ecchymosis, moles, bruising. I take a look from one angle for any visible hernias and from another angle for any visible hernias. There are none noted. Okay, now I'm just going to be taking a listen to your stomach. Can you tell me when your last bowel movement was?
Yesterday.
Yesterday. Do you have any concerns? Maybe a little constipated, any diarrhea? No? Okay. I'm just going to be taking a listen now. Bowels are active with 5 sounds in each quadrant. Now I'm going to be listening for any bruits. No bruits noted. Okay, Kylie, now I'm going to be feeling around a little bit. Before I do that though, do you have any areas that are particularly tender that I should stay away from? Let me know if you do feel any tenderness, okay?
Okay. I'm just ticklish.
Just ticklish, okay. Right, no problems there? Okay. You can pull your shirt down. And I'm just going to be taking a look at your legs here. I'm going to unravel you. Let me pull up the claims. And take note of the overall skin color. If there are any signs of any wounds, any lesions, any ecchymosis, bruising, arrhythmia, not noted. The client's skin color is even throughout, on hair and distribution are even. I'm going to be testing for some edema, so I'm just going to press down. No edema noted. No edema noted. Okay, now I'm just going to be feeling for the client's pulses behind the knees. Pulses are +2 bilaterally. Pulses are +2 bilaterally. Pulses are +2 bilaterally. I'm going to pull these down, and I'm going to have you actually, can you bring your knee to your chest for me, please? And then out to the side. And then can you drag your heel onto the shin of your left leg, all the way down to your foot? Can you repeat the same thing on the other side? All right, is able to perform range of motion and good balance and coordination. All right, I'm going to have you pull against my hands here. Okay, and then push. Okay, no problems with everything like your toes. Lower your head down. I'm going to have you sit up for me. Okay. Get on your shoes. And I'm going to have you walk a little bit for me. No fall risk here. I'm just going to have you walk over there for me. And observe your feet. No problems there. And I'm going to have you walk heel toe about halfway. And then can you walk on your tippy toes all the way back to the bed. And now stay right there for me. Have you turn this way. I'm going to have you close your eyes. Form a longer chest. No visible signs of any swaying. Go ahead and sit back down for me. Now I'm just going to kind of do something kind of fun here. I'm going to either give you a little tap with something dull or something sharp. Okay, you're going to tell me if you feel it and where, okay? I'm going to have you close your eyes and just let me
Sharp on my right.
in.
Sharp on my left arm. Sharp on my left. Dull on my right foot.
You're perfect. Any deficiencies there. And now I'm going to be hitting this, and you're going to tell me if you feel a vibration and where. Same thing, eyes closed.
I do feel on my left leg.
Okay.
Feel on my right bicep. Left forearm. Right lower leg.
Okay. And now, I'm just going to be testing your reflexes. Okay. So I'm going to start with your arm here. do bilaterally. And I'm gonna test your tricep here. I'm gonna have you come down like that and completely rest it. Relax. Let's do bilateral. Okay, and now we're testing your knees here, so just relax. Pants are stalled. Oh, let's do bilateral. I'm gonna have you stand up one more time, please. And you're just, I'm just gonna have you put your knee like that on the bed. Okay, testing this reflex here. Okay. And then other side, please. Flexors are plus 2 bilaterally. And go ahead and have a seat again. Can you tell me those 3 words that I had told you at the beginning of the assessment?
Right, right, kind of right.
Okay. You're welcome to lay back down and get comfortable. We're all done here. Okay. And here is your call light. Is there anything I can do for you before I go? No. If you do need something, just let me know, please. Okay.